Well, there's this synergy between diabetes and ApoE4, and that is to say, as you would expect, if you happen to carry both, then your risk of Alzheimer's disease increases 500% as opposed to carrying the ApoE2 or ApoE3 allele. Interestingly, the ApoE is co-located or lives where around the amyloid protein. If you happen to be on the far right side where you have diabetes and the ApoE4 in the red column, your risk is dramatically increased. So we have to get away from this whole concept of genetic determinism and talk about genetic predisposition. Identify individuals who have risk for disease and nip it in the bud. The thesis of my new book called Raise a Smarter Child by Kindergarten is that we have a profound influence over genetic expression. We can turn on smart genes in infants and preschoolers and make them and allow them to have better expression of what their genes wanted to do in the first place and give them higher IQs just by providing them certain influences on their genetic expression. And this is an important law of heredity, that it always comes from the other parent. You know, I have to say I've used that before. That didn't come from our side of the family. Well, again, diabetes is related to Alzheimer's disease because we know diabetes leads to vascular disease that relates to brain, dislocation of protein, and this amyloid. Well, let's take a closer look at this oxidative stress, the turning on of free radicals in the Alzheimer's brain. If you measure what are called T-bars, it stands for something called thiobarbituric acid reductase substance. It's a fancy name. It's a measurement of free radical damage to fat. In the Alzheimer's brain, it's dramatically increased because, why would that be? Why would they have excessive free radical activity? Anybody? You know what's going in my mind right now? It's the Jeopardy theme song at the end, Final Jeopardy. Time is up, the pen's down. Well, it's because they don't have antioxidant protection in their brain as well as other people. So their production of free radical, the damage to fat in the brain, is increased. You can actually measure your own T-bars at home. You can buy a kit called a urine lipid peroxide kit. You go to a website called ulptest.com and get a kit. Send a urine specimen. It'll tell you if your antioxidants are working or not. So, why would it be that Alzheimer's patients have increased free radicals? Let's look at their vitamins. Their vitamin C levels are lower, vitamin E levels are lower, vitamin A levels are lower. Well, it gives us an idea. If you saw this information, you're a research scientist, what would you want to do? Wouldn't you want to maybe intervene, give Alzheimer's patients antioxidants or people antioxidants and see what happens? Well, matter of fact, that just happened and published in the Archives of Neurology. The Archives of Neurology is put out by the American Medical Association. And they found out that people who used multivitamins, vitamins E and C, this study looked at 4,750 participants who were not Alzheimer's patients, and it found that the risk of Alzheimer's, the prevalence of Alzheimer's in people who took C and E was decreased by 78%. Let me let that one hang a moment. The risk of Alzheimer's published by the American Medical Association was diminished by 78% of people taking two common antioxidants. Now, how many people truthfully have heard of this study? Not a hand. There's something wrong here. There's something very wrong. Because when you watch the evening news, what do you see? This is what you see. And that is, live your life come what may, and then when you start to, you no longer have both oars in the water at the same time. You're no longer, you're a couple tacos short of a combo platter. You're supposed to take this drug. Right? This is what isn't this true? I watched the evening news 2 nights ago, and it was on. This is what we're told to do. It's in Parenting in all the trade magazines, it's in Newsweek and Time, and it's wrong, because the American Medical Association tells us that we can reduce the risk of Alzheimer's dramatically. But you don't see that on the evening news, because no one owns vitamin C and vitamin E. But this is what we're told to do, because this stuff really works. And here's a study published in the journal Lancet, looking at donepezil, which happens to be Aricept, and they looked at how effective it is. And here's what the Lancet tells us about this drug. It has no measurable reduction in rate of institutionalization or progression of disability. It is not cost-effective with benefits below minimally relevant thresholds. I saw 2 nights ago on the evening news the ad for this medication for Aricept, and it said studies have shown that this slows the disease, reduces risk of institutionalization. This says that these findings are disappointing little overall benefit of the medication. So the other night they said, yes, it slows the disease. Studies have shown. Well, I would ask you, this is the British Medical Journal. Again, one of the most well-respected peer-reviewed journals on the planet. And what they did, they reviewed every study ever done on this drug. Okay? And here's what they found. Because of flawed methods, small clinical benefits, the scientific basis for recommending these inhibitors in Alzheimer's disease is questionable. Every study that's been done, and here's their recommendation to doctors. The summary, what this study adds, the recommendation for the use of cholinesterase inhibitors do not seem to be evidence-based. The benefits are minimal, and the methodological quality of the studies being done to evaluate them is poor. You know, as many of us who do so-called complementary medicine, have been accused in the past of, well, what you're saying isn't really evidence-based. You know, you're talking about nutritional things. The standard should be that they challenge people like myself. They say you should be using peer-reviewed studies. I am using peer-reviewed studies. You know, if that's the standard of judgment, these studies are published and they show us that the medications that doctors are prescribing left, right, and center are not working, and that we can prevent the disease in the first place. So it's tough. Keep this in mind if you want to talk to your doctor about it. Published in January 2004. Ignore it, Henderson. It's unscientific. Okay. I'll speed things up here. Treat the fire and not the smoke. That's what this is all about. Well, how do we do that? We turn on the mitochondria, these things, these energy-producing things in the brain that, when they're not working effectively, increase the production of free radicals. Free radicals come from the parts of the cell called the mitochondria. Remember the energy powerhouses of the cell? What can we do to turn on the mitochondria? Let's first look at coenzyme Q10. When you look at various species of animals, the levels of CoQ10 correlate dramatically with the production of superoxide radical. This is a very damaging free radical, especially in the brain. Lower levels of CoQ10 are associated with increased level of superoxide generation. Gives you an idea that CoQ10 might be important. Dr. Schultz and M. Flint Beal, when he was at Harvard, looked at CoQ10 levels in, for example, PD patients, Parkinson's disease. And he found, which really retrospectively is not a big surprise, that CoQ10 levels are depressed in a person, in patients, who have diseases characterized by excessive free radicals. We looked earlier at vitamin levels in Alzheimer's patients and found that they were low. There's a direct correlation between low CoQ10 levels and Parkinson's. What they found was that because the CoQ10 levels were low, that the mitochondria were not functioning efficiently, and their thought was that low CoQ10 decreases mitochondrial efficiency and leads to reduced antioxidant protection, increased damage to the neurons. CoQ10 protects the brain cells. In the Parkinson's patients with low CoQ10, their brain cells are not protected, and so they are damaged and they have clinical disease. Well, he said, let's see what happens to plasma levels of CoQ10 as we increase our dosage, and found a dramatic increase in coenzyme Q10 levels when you take an oral dosage of CoQ10. That's a good thing to do as a preliminary test. If you're going to design a study to see if CoQ10 does anything, the first thing you need to know is, well, if you take it by mouth, does it get into the bloodstream? They proved that it did. And then they decided to do something that was really kind of dramatic and I think really kind of breaks the mold. They used this nutritional supplement called coenzyme Q10 and actually gave it to Parkinson's patients. A nutritional supplement intervention. And what they found was really quite fascinating. That let me go back if I may. The degree of decline on coenzyme Q10 was slowed by 48% in 1 year. Patients taking the highest levels of CoQ10, their rate of decline slowed by 48% in 1 year compared to people not on coenzyme Q10. I would say probably about 3 to 4% of my neurology colleagues use CoQ10 in their practice. It was published in the journal Neurology. That's the American Academy of Neurology. And the study took place at the University of California, but they did it at 8 different high-level institutions.